Day 1176 of this Trump administration, 208 days to go now until the presidential election. And by the way, the Republican leader in the House today echoed the president, making it clear the Republicans are dead set against voting by mail in this country. At today's White House briefing, the president said we're at the top of the hill, presuming he meant the curve. He said we've had a tremendous day. He promised lots of good news to report tomorrow. He talked about death today, called it a terrible word, a terribly dark word, while still contrasting the death toll against the worst of the projections. His way of projecting that he has acted decisively, acted early, as he likes to say. While promising massive testing in certain areas of our country, as he put it, he said there won't be widespread testing of Americans prior to people someday going back to work. And on that front, he again said, we're going to be opening up. We call it opening very, very soon, I hope. In the meantime, and in the real world, another record day in some areas in terms of our death toll. This virus has now killed more than 16,000 Americans. More than 462,000 have been infected. The vice president proudly said today, we've tested 2 million Americans, but in a nation of 327 million, that's less than 1% of the population. And today's count of confirmed cases, 462,000, means just under a quarter of all those tested are testing positive, presumably because this early scramble to test people has been of the already acutely ill. Tonight, nearly every state is under a major disaster declaration because of this virus. With that comes the continued relentless hemorrhaging of jobs in our economy. Last week, 6.6 million Americans filed for unemployment benefits. That means almost 17 million people have lost work over these past 3 weeks. That means just those, by the way, who've gotten through on crashing websites to file their claim. When asked what he would tell those newly unemployed, Trump predicted a reopening of the economy would take care of things.
From an economic standpoint, we met with the mental health people today. And that this has taken a tremendous toll mentally on a lot of people. And I think we're going to open up strong. I think we're going to open up very successfully. And I'd like to say even more successfully than before.
NBC News has confirmed a Washington Post report that says a new task force is being created to deal with this pandemic economic fallout. But there were no details on that in the West Wing today. The president is eager to get Americans back to work, yet there's still not the necessary capacity to test, track, and trace everyone exposed to this virus, despite what the president says from the podium.
We passed 2 million tests completed in the United States, first time. Most anywhere in the country. It's a milestone for our country. It's a milestone anywhere. Our tests are highly sophisticated and highly accurate.
Again, this bears repeating. As of tonight, less than 1% of the U.S. population has been tested. That means we still have no real idea how many Americans are walking around with this virus. There's also concern tonight about the nation's next metropolitan hotspots. Chicago and Boston, as well as the nation's capital and surrounding areas. The virus continues to take hold in rural America, too, just as more small hospitals across our countryside are closing. It is clear the nation has a way to go before declaring this battle won. And Dr. Tony Fauci warns it's unlikely every section of the country will reopen at the same time.
What is the medical criteria that you guys are discussing in order to reopen the government? What is the medical criteria?
Well, it's less medical criteria than it is public health criteria. And that is, and I think it's really important because often people say reopen the government like it's a light switch that goes on and off for the entire country. We have a very large country with really different patterns of disease and outbreaks in different parts of the country. So it's not going to be a one-size-fits-all.
And yet there was this. We heard today from Attorney General and noted public health expert Bill Barr questioning how long the current stay-at-home guidelines should stay in place.
We have to be very careful to make sure this is, that the draconian measures that are being adopted are fully justified and they're not alternative ways of protecting people. And I think, when this period of time, at the end of April, expires, I think we have to allow people to adapt more than we have, and not just tell people to go home and hide under the bed, but allow them to use other ways, social distancing and other means, to protect themselves. We will have a weaker healthcare system if we go into a deep depression. So just measured in lives, the cure cannot be worse than the disease.
Across the globe, around our world, the number of cases has now climbed past 1.5 million. Tonight, British Prime Minister Boris Johnson is out of intensive care. He remains hospitalized, however. And in England, a doctor who wrote an urgent appeal to Johnson back on March 18th, asking for more PPE for frontline medical professionals, has now died from the coronavirus. In the nation's epicenter, devastating loss was again coupled with signs of progress. New York State has the most cases in the nation. They have more cases than any country in the world aside from the United States. As Governor Cuomo announced, 799 people died in New York in a single day, the highest one-day loss thus far. He said the number of patients admitted to hospitals grew by the smallest number in weeks.
You can flatten the curve. We are flattening the curve by what we're doing, and we're flattening the curve so far. We should all be concerned, especially New Yorkers. Well, we're flattening the curve. That's good news. It is good news. Well, now I can relax. No, you can't relax. The flattening of the curve last night happened because of what we did yesterday and the day before and the day before that. If we stop acting the way we're acting, you will see those numbers go up.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.